Okay, this is chapter 19, Grooming. As you know, to pass through this chapter, you must read, you must take down notes and study. You need to know your objectives, key terms, and key abbreviations, and know the skills of the chapters where the skills are related to. Focus on the communication with the client and the staff. Focus on the boxes and tables and figures. Make sure you know them. Be comfortable with them. Review promoting safety and comfort. Review residents with dementia. Review procedures, caring about culture, teamwork, and time management. Time to reflect, quality of care, and make sure you do the questions at the end of the chapter. We know the contents. You have what the chapter consists of and what you need to know. So we'll go ahead and get started with grooming. Hair care, shaving, and nail and foot care. To prevent infection and promote comfort. Affect love, belonging, and self-esteem needs. Here you are shown grooming aids. The figure A shows long handle combs and brushes are used for hair care. B is a button hook is used to button and zip clothing. C, a sock assist is used to pull on your socks and stockings. And D shows a shoe remover is used to take off the shoes. In this way, the client can feel more self-esteem of dressing themselves, doing their own care, grooming care. Hair care, you assist with hair care whenever needed. The nursing process reflects the person's culture, personal choice, skin and scalp condition, health history, self-care ability. Skin and scalp conditions include hair loss or excessive body hair, dandruff, and lice and scabies. How the hair looks and feels affects mental well-being. Many nursing centers have beauty and barber shops for the residents so they can get their grooming care done on their hair, because that's still important even when they're older. Skin and scalp conditions. You have alopecia, it's a hair loss. You have hirsutism, it's excessive body hair. Hirsutism, it can occur in women and children. Hirsutism, it results from hereditary and abnormal amounts of male hormones. Dandruff is the excessive amount of dry, white flakes from the scalp. Itching often occurs when you have dandruff. And it's just sometimes the eyebrow and ear canal are involved with the dandruff. And you can also have excessive eyebrows too, and excessive hair in the ear canal. And that's one reason why you can have dandruff in there too. So, lice, lice pediculosis is the infestation with wingless insects, lice. Pediculosis captitis is the infestation of the scalp with lice, aka head lice. Pediculosis pubis crabs is the infestation of pubic hair with lice. Pediculosis corporis is the infestation of the body with lice. Lice easily spreads to others. If you're standing near someone, they can just hop on to you. Report signs and symptoms of lice in the nurse at once, because it will spread. Lice spread through clothing, head coverings, furniture, beds, towels, bed linen, and sexual contact. They also are spread by sharing combs and brushes. That's why you never share personal items, not even makeup. Lice attach to eggs, nights to hair shafts, and then the nits are oval and yellow to white in color. They hatch in about a week. Lice are treated with medicated shampoos, lotions, and creams. Thorough bathing is needed, as is washing clothing and linens in hot water. Signs and symptoms of lice include complaints of a tickling feeling or something moving in the hair. You can actually see when someone is infested with lice, you can see the person's hair actually moving. Itching, irritability, sores on the head a body caused by scratching or rash. Scabies. Scabies is a skin disorder caused by a female mite. A mite is a very small spider-like organism. The female mite burrows into the skin and lays eggs. When the eggs hatch, the females produce more eggs, so the person becomes infected with mites. The person has a rash and intense itching. Scabies is highly contagious and is transmitted by close contact. Treatment is the application of creams to kill the mites. The person's room is cleaned and the clothing and linens are washed in hot water. Scabies is a skin disorder caused by a female mite. A mite is a very small spider-like organism. Common sites of scabies are between the fingers, around the wrist, in the upper arm area, on the thighs, and in the genital area. Other sites include breast, waist, and buttocks. Persons living in a crowded living settings are at risk, as are persons with weakened immune system. Bed bugs. Bed bugs are small, flat, reddish-brown insects that live in or around where people sleep. They feed on the blood of people or animals. It is difficult to control infestation, and professional pesticide companies are often used. People often don't know when they are bitten. After red marks appear, they realize they have been bitten, and the marks look like mosquito bites and are itchy. They are also very itchy. And one thing you need to know with the bed bugs, for your protection, anybody else's protection, you don't buy used stuffed furniture. If you buy used furniture or furniture that's wood, that's fine because you can sit it outside and let the sun hit it and clean it and spray it down. But the upholstered furniture are very hard. They get into the cushy stuff and stay in there, and you have to have the people come out and come out and get it cleaned. There has been a recent surge of bed bugs infestations in many different settings, including long-term care centers and hospitals. Bed bugs can travel in luggage, bedding, furniture, clothing. They often hide in places like seams of a mattress, headboards, tables, and cracks of walls, especially around the outlet in the walls because it's warm. That's why they wait for you to go to sleep. They have a kind of a sensor thing inside them. They know when you go to sleep and they come out, and that's when they start biting you, and they know when you're getting ready to wake up, and they scurry away and go back to their safe spot. You don't see them when you wake up because they know you're waking up. They get away from you. But that's how you get bitten. It is difficult to control infestation of the bed bugs. If you see bed bugs, report it immediately. The use of high heat, chemical pesticides, and thorough cleaning may be used. Brushing and combing. Encourage residents to do their own hair. Assist as needed. Perform hair care for those who cannot do so. The person chooses how to brush, comb, and style their hair. When brushing and combing hair, start at the scalp, then brush or comb to the hair ends. And of course, you know if a person's hair is curly, you start at the end and then work up. Brushing increases blood flow to the scalp and brings scalp oils along the hair shaft. Part the hair, and when you do part the hair, you want to part it in straight down the middle, and then you do those and divide those in two sizes. Then part one side into two smaller sides and keep going like that. Okay? You must not braid hair without the person's consent. You cannot cut matted or tangled hair, cut hair for any reason. Special measures are needed for curly, coarse, and dry hair. Brushing increases the blood flow to the scalp and brings scalp oils along the hair shaft. Shampooing frequency depends on the person's needs and preferences. The shampoo method depends on the person's condition. Safety factors, for example, water temperature of 105 Fahrenheit, personal choice of water temperature. Also, there's shaving and nail and foot care. Describe the measures practiced when shaving a person. Explain why nail and foot care are important. When you are shaving, whether women shave their legs or underarms varies among cultures. Legs and underarms are shaved after bathing. The skin is soft at this time. Soap and water, shaving cream, or lotion is used for leather. Review the rules for shaving in box 19 in the textbook. Follow the manufacturer's instruction for brushing out whiskers from an electric shaver. And also because oil gland secretion decreases with aging, older individuals have dry hair. Usually shampooing is done weekly on a person's bath day. Persons may use regular shampoos and conditioners or medicated products ordered by the doctor. And residents usually need help with shampooing dry and style hair as quickly as possible after shampoo. Now, because oil gland secretion decreases with aging and older individuals have dry hair, just make sure that person or the family member is aware that they might need special shampoo or something like that for their hair, so they won't become so dry. Okay. Now, many men shave for comfort and mental well-being. Many women shave their legs and underarms. Coarse facial hair. Safety razors and electric shavers are used. If the center's electric shaver is used, clean it after every use. Collect shaving, and of course now I think everyone has their own everything now. Collect shaving items with bath items. Use the kidney basin to rinse the razor. Do not use the bath water for shaving, please. Safety razors, risk factors, and caring for facial hair. Safety razors are not used on persons who have healing problems, for those who take anticoagulant medications, drugs, on individuals with dementia. Mustaches and beards need daily care also. And you have to make sure that they are shaved. Bleeding occurs easily and it's hard to stop. So if they're on that anticoagulant, make sure you do not nick or cut, because it can cause serious bleeding. So electric shavers are not used. Nail and foot care. Nail and foot care prevents infection, injury, and odors. Injuries occur from stubbing toes, stepping on sharp objects, being stepped on, shoes that fit poorly, trimming and clipping toenails in persons with diabetes and vascular diseases. Hang nails, ingrown nails, nails that grow in at the side, and nails torn away from the skin called skin breaks. These breaks are portals for entry of microbes. Long or broken nails can scratch skin or snag clothing. Feet are easily infected and injured. Dirty feet, socks or stockings harbor microbes and cause odors. Shoes and socks provide warmth, moisture environment for microbes to grow. So make sure also when you're dealing with the nail and foot care, also remember that they have hang nails, ingrown nails, nails torn away from the skin called skin breaks. And remember those things. Nail and foot care. As you can see, I do not think any facility allows anyone to cut toenails or fingernails due to being a diabetic. But clip toenails straight across. Use a nail clipper if they do allow it. Smooth the rough edges of the nail with an emery board or nail file. Make sure you ask the nurse first. This is extremely important because you can nick the skin, and if that person is a diabetic and they don't know they have turned where they are a diabetic now, because you could be a diabetic, not a diabetic 1 month and then become one the next month. So be very, very careful. Dressing and undressing. You may need to assist with changing clothes and hospital gowns, provide for privacy, encourage the person to do as much as possible, let the person choose what to wear, remove clothing from the strong, unaffected, or good side first, put clothing on the weak, affected side first. You remove clothing from the strong side, or good side, and you put clothing on the weak side first. Support the arm or leg when removing or putting on a garment. In addition to morning and evening changes of clothing, garments are changed whenever wet or sore. You may need to assist with changing clothes and hospital gowns. Dressing and undressing, you see the demos. Okay. The top one in the middle, the sides of the garment are brought from the back to the sides of the person. Note that the weak side is indicated by slash marks. Okay. And the left side of garment that opens in the back is removed from the person in the side lying position. The far side of the garment is tucked under the person. The near side is folded onto the person's chest. Note that the weak side is indicated by the slash marks. On the right side, the garment is removed from the strong side first. Note that the weak side is indicated by slash marks. Dressing and undressing continues. Some residents dress and undress themselves, others need help. Personal choice is a resident right. Changing hospital gowns. Some residents wear hospital gowns. Gowns are usually worn for IV intravenous therapy. If there is an injury or paralysis, the gown is removed from the strong arm first. Support the weak arm while removing the gown. Put the clean gown on the weak arm first and then on the strong arm. Most residents wear street clothes during the day. Some wear hospital gowns. Gowns are usually used again for the IV therapy. Some residents may only wear hospital gowns at night. This makes changing incontinent products easier. Quality of life. Grooming measures promote comfort, help the person's body image and esteem needs, help mental well-being, encourage and allow personal choice whenever possible, carefully handle the person's grooming products and personal care items. Record your observations and the care given according to center policy. That's it. We'll catch you on chapter, I believe, 20 coming up soon. Okay.